So today we're going to have this short discussion on the anatomy of the larynx, and for that I have this three-dimensional model of the larynx, which is in front of you. So this interactive three-dimensional model, as you can see, we can move it around and we can see the different parts of the skeleton of the larynx. So the larynx, which is commonly known as the voice box, it is lying in the anterior midline of the neck at the level of the cervical vertebrae, 4th to 6th. And over here, you can see the hyoid bone. If you follow my pointer right now, it's pointing towards the hyoid bone, which is not a part of the larynx, but it is attached to the larynx, lying above it. The larynx itself consists of different cartilages. We've got some paired cartilages, we've got some unpaired cartilages. Well, over here, let's focus on this blue cartilage. And this is showing you the anterior aspect of the larynx. And the anterior aspect of the larynx, you can see that the largest, most prominent cartilage in the midline, which is in blue over here in this model, is the thyroid cartilage. And this cartilage consists of two quadrilateral laminae. This is one, and the other is the one over here. These two quadrilateral laminae, they fuse in the midline, forming this superior V-shaped thyroid notch. And this produces a prominence which is known as the Adam's apple. The Adam's apple is more prominent in males and can be palpated superficially in the midline of the neck. The quadrilateral laminae, they taper posteriorly, forming the superior and the inferior horns of the thyroid cartilage. So let's look at this posteriorly. Looking at the larynx from posteriorly, we can see these are the two superior horns and then the two inferior horns of the thyroid cartilage. The thyroid cartilage is the hyaline cartilage, and we can see it's unpaired and it's the most largest one, but it is deficient posteriorly. Then comes the other cartilage, which is also a hyaline cartilage, which is in green in this model. It is the cricoid cartilage. The cricoid cartilage is the only cartilage which is forming a complete ring anteriorly as well as posteriorly. So anteriorly, it is in the form of a narrow arch, but posteriorly, this arch broadens. And you can see this is the posterior lamina of the cricoid cartilage. So this cartilage is also hyaline cartilage, and it is in the shape of a signet ring, which means it is broad posteriorly and it is narrow anteriorly. It is attached to the hyaline cartilage over here, where the inferior horns of the hyaline cartilage form the cricothyroid joints. One is over here and the other one over here. Also, the cricoid cartilage external to larynx is attached to the first tracheal ring by the cricotracheal ligament. Okay. And posteriorly, you can see on the upper aspect of the posterior lamina of cricoid cartilage rest the paired arytenoid cartilages. The arytenoid cartilages are largely hyaline, only their apical region is elastic cartilage. They form the cricoarytenoid joints with the cricoid cartilage. We'll come to these later. Let's look at this purple area, which is representing the epiglottis. This is the third unpaired cartilage of the larynx, and it is lying in the midline. It is present behind, you can see this hyoid bone. So behind the hyoid bone is the epiglottis. And the epiglottis is an elastic fibrocartilage. Its structure is described to be in the shape of a leaf, meaning it has a broad upper end which is directed backwards and it is pitted. The narrow stalk, which is present in the lower part, is attached to the posterior aspect of thyroid cartilage by this thyroepiglottic ligament. Okay, so the epiglottis, you know, it moves or bends backwards during swallowing to prevent the passage of food and liquid into the laryngeal inlet. Now let's look at the paired cartilages. So coming back to the arytenoid cartilages, these are orange colored over here, and they are pyramid in shape. These are paired. And like I said before, they're largely hyaline, but their apical region that is elastic. So they are pyramid shaped with the base of the pyramid resting on the upper aspect of cricoid cartilage, the apex pointing upwards, and there are two processes. The laterally projecting process is known as the muscular process, whereas there's an anteriorly projecting process. If you can see over here, this is the anteriorly projecting process, which is long and narrow and called the vocal process. Over here, the vocal ligament is attached. On the superior aspect of the arytenoid cartilage rests the corniculate cartilage, which are the nodule-shaped cartilages, and they are elastic fibrocartilages, to which the aryepiglottic folds are attached, although not shown here over here in this model, but the aryepiglottic fold is attached to the corniculate cartilages and also contains the cuneiform cartilages, which are small nodules of elastic fibrocartilage. Then there's also the other paired cartilages. Those paired cartilages are trichet cartilages, which are present over here, where you can see my pointer. Right now, it's pointing towards the trichet cartilage. This is present in this band, this thickened ligamentous band, which is known as the lateral thyroid ligament. It's a thickening of the membrane between the hyoid bone and the thyroid cartilage, which is called the thyroid membrane. This membrane posteriorly has openings for the superior laryngeal artery and the internal laryngeal nerve. They pass through this membrane. So this was a discussion on the different parts of the laryngeal cartilage. And also we can see, if you can look at it from above, that these here are the vocal cords or folds which contain the vocal ligaments. Vocal ligaments are avascular mobile ligaments which are attached anteriorly to the inner aspect at the mid-level of the thyroid cartilage angle, and posteriorly they're attached to the vocal process of the arytenoid cartilage. So let's look at this model of the larynx from above. The space or area between the vocal cords anteriorly and the arytenoids posteriorly, this is known as the glottis. And we know that passage of air through this area produces a movement of the vocal cords, which is responsible for phonation or sound production. This is why the larynx is commonly referred to as the voice box. So this ends the brief description of the skeleton of the larynx, which I hope was better to understand with the help of this model over here. Okay, so we'll be ending with that. Thank you.